Hi, I'm Naisha McCauley, and you're watching AccessTV.org.
Good morning, this is Jonathan Small, host and producer of All About You. This show is broadcast every week at AccessTV.org studios in downtown Hartford. And this show is designed to give the guests a chance to give their life story. This morning I have a guest that has a few interesting titles. He is a medical doctor, he is an author, and he's going to come down this morning to pretty much give his life story. This morning I have medical doctor Gary Rhule. Good morning, Gary.
Good
How
morning.
you doing?
I'm well, thank you.
All right. Could you kind of let people know exactly where you were born and raised?
Sure. I was born in Kingston, Jamaica.
Okay.
And lived there for 14 years. Moved to Hartford. Actually moved to New York City in 1976. But I live in Hartford, in the Hartford area now.
Okay. Now, when you was in Kingston, Jamaica, did you have an interest in getting involved in the medical field? Is that where your life pretty much started, towards that level?
Pretty much. I mean, I pretty much knew I wanted to be a doctor from I was a young kid, probably from 7 or 8 years old. And I had an interest in sciences, biology, chemistry, and math. And I really pursued that through my entire life.
Was it something kind of a difference studying to become a doctor in Jamaica comparable to the United States?
No, I think that really the difference, to be a physician really just means that you have to really read a lot, and you have to be really inquisitive to find out how things work, whatever it is. It could be something in your home, it could be electricity, whatever it is, but just that curiosity about how things work. But specifically for medicine, really how the body works.
Okay.
And then you really have to like to read, just be able to really read anything.
But you left Jamaica at a real early age, so you really didn't go to high school in Jamaica, did you?
Well, the system is somewhat different there, so I started high school, because we start high school at 12.
Okay.
And so I started high school there, went to Wolmer's High School for 2 years, and then came here.
Okay. Now, when you came here to the United States, where was the first area of the country that you come to?
I lived in New York City with my grandparents for about 4 months, and then came to Hartford in August.
So you really didn't stay in New York that long to
No.
kind of really get a feel of what the city is like.
No, but it was really nice though, because coming from Jamaica, you know, obviously there are lots of buildings, lots of people, lots of cars, and it's completely different. So you really do get that culture shock when you come to New York from a small country like that, because you recognize how massive the country really, well, the city really is, and how very organized things are. So it's exciting to be in a place like that, really for anyone actually.
Which particular borough did you move or did you stay at for the first 4 months?
In the Bronx.
Oh, the Bronx. Okay.
In the Bronx.
All right. Now, obviously, you would stay in the Bronx for 4 months. Then you came to Connecticut. And what was it like coming to this state, Connecticut?
Well, very different, because Connecticut is much more rural, I guess, compared to New York. And but for me, I liked it because there's more space. There's more green space. It's less congested than New York. So specifically, for me, I actually preferred it. It's really much more like Jamaica, actually.
Okay. And you have a large Jamaican and West Indian population in many of your cities, and actually the total state here.
You do.
And to do that. So basically, you had no interest at this point of going back to New York. You just wanted to really start your life here in Connecticut at that stage.
Well, I mean, I love New York. I mean, I love New York because of the activities, right? For the concerts, the plays, the sports events. I like that part of New York City. But I also like to kind of relax and to be really about the trees and more space. So I kind of like both. I like the fact that I'm close to New York City, but don't live in New York City.
Okay. And I guess in Jamaica, there's many places like Kingston. You have a real crowded, popular city. Then you have a lot of rural areas also that you can kind of go to. So it's kind of some similarities.
Very, very similar.
When you do that. Now, you had an interest in becoming a medical doctor. So what was the mindset that you had to have going into high school, you know, preparing yourself to become a doctor?
So getting into medical school is very competitive. And what is really required is to really have good grades. And so you have to really be able to study really well, do well in your classes, really manage your time very well in terms of just the classes that you have to take through high school. But really the bottom line is just to do really well in the sciences, because what the colleges look at really are the sciences and your math courses. And so you really have to do very well in that. But the flip side of that as well is, even though you have to do well in the sciences, because in medical school and in college, you really have to read a lot, you have to kind of balance both. You have to read really well, or read a lot, and it doesn't have to be sciences. It could be the newspaper, it could be a sports magazine, it could be really anything that you like to read. And I think that as I look back now, I tell people, it's not really about the sciences, it's just reading. It doesn't really matter what you read, because that's what really helps you to understand, I think, and increases your comprehension, just reading, anything.
Okay, but when you're studying to learn math and science, did the school system that you was involved with preparing you for the type of courses? I mean, did you go to a good high school or just any particular public school? I mean, what kind of high school did you go to?
I did. I went to Weaver High School.
Okay.
And so in terms of the classes, yes, there were some limitations in terms of some of the classes that were offered. But in terms of, I mean, I took chemistry there, I took physics there, I took trigonometry there, algebra. And then in the senior year, when I wanted to take calculus, I actually went to the University of Hartford. But the Hartford school system facilitated that. So even though that wasn't offered at Weaver then, I was able to do that at at University of Hartford. So the system, certainly there are some limitations for the system, and no school system really will be perfect.
Right.
I think if you express the interest to your teachers and to your guidance counselors, they can facilitate you actually getting the work somewhere else. And you'll never really be prepared even when you go to college, because you'll find that there's some people who are exposed to classes that you'll never ever be exposed to. But I think if you express that interest to your teachers and your guidance counselors, there are other ways you can kind of make up for that lost opportunity. The other thing I think that I recommend that people do is to help themselves to read outside of the classroom.
Okay.
Because you could, for example, if you had an interest in English literature, and that's not offered in school, to go to the library, pick that book up, and really help yourself study that way. And that's one of the things I actually do. So if there was a class or an interest that I have that's not offered, I went outside and found that information. So you kind of have to do that, I think, when you're just learning to teach yourself, really, is one of the things I think you should do.
Was there any personal sacrifices that you had to make preparing yourself to go off to college and medical school, whether it's financial sacrifice or whether it was just personal sacrifices of giving up, free time for playing? Because many people don't realize what the requirements and the sacrifice sometimes that you have to make if you want to become a doctor. Could you kind of let people know exactly what type of sacrifices?
Absolutely. I think that the biggest piece is really you have to learn to manage your time. So while you could be really spontaneous, when friends were being spontaneous to go to a concert, to a play, to a party, you really could not do that because you had to manage your time where everything was really kind of in a schedule. And it takes a lot of time. The classes are difficult and not easy.
Okay.
And you have multiple classes that you're kind of juggling. And so, sure, I missed a lot of parties, a lot of sporting events, a lot of times with my family because I had to study.
Right.
But I think, again, if you really kind of want something like that, that's what you really have to do. There will be times when you just have to miss things. But it's a lot of time.
Okay. Did you have any particular doctors or anybody that you kind of looked up to that you gave your interest?
I didn't really, unfortunately, but I think that's good to have a mentor, but I didn't.
Okay.
I mean, I really kind of knew I wanted to be a doctor, and so it's helpful to have a mentor and to have someone help you guide you through the system.
Right.
I think it would have made it a lot easier, but I didn't have that at all.
Oh, okay. Now, when you're pursuing to become a doctor, are you looking at the financial rewards or are you looking at the rewards to help people? I mean, what is the type of mindset that you have to have when you're getting closer to becoming an actual doctor?
Well, I mean, certainly as a physician, because you spend so many years in preparation, the salary is fairly good. But if you look back in terms of the amount of time that you've spent, in terms of studying, you can't really just look at the salary or the financial rewards because you're going to end up, even if it's as a physician, missing time with your family,
Okay.
missing time with your friends. Just a lot of events that you're gonna pass up on because the work is really intensive. And I think ultimately what you have to try to do is do the work that you love doing.
Okay.
A lot of people come into medicine because, of course, they're attracted by the security of the work and the fact that the salary is fairly decent. You get attracted by that. But ultimately, if you don't like people, if you don't like working with people,
Right.
if you don't like working with them when they're really the most vulnerable or in pain, you're not really going to enjoy that work. So, yes, probably you really have to kind of love people. If you don't love people, I think eventually you find that you actually go do something else.
Well, it's kind of, you have to have like a love for helping people to make sure that you want to serve people's medical and, you know, mental and even spiritual needs, because just studying the physical aspect of a doctor, but there's other mental and psychological issues that you have to deal with too.
Absolutely. I mean, I think that a lot of persons who come into healthcare in general probably have a family history of some health condition that they're trying to actually understand themselves. And so a lot of persons are attracted for that reason. But when you're a physician, you're kind of coping with and helping persons with not only their physical self, but their mental self. And a lot of it is actually also spiritual.
Okay.
So you really kind of have to be able to do both.
What was your first job after graduating medical school that you worked at?
I worked at St. Francis Hospital in the emergency room. That was in 1991.
Okay. What was that experience like working at St. Francis Hospital, a medical emergency room?
Very good. I think the thing about being a physician, especially in the emergency department, is you meet people from all walks of life. And then you also really, every day is unexpected. So you have to be prepared to cope with anything that walks through the door, whether it's a baby with belly pain or diarrhea or an earache, and then an older person with a stroke, a young man with a heart attack. Really anything could walk through the door. And so it's very exciting because you get really I think the best of both worlds.
Okay.
Persons could walk off the street from any ethnicity, any race, any class. Some persons are homeless. Really just anything could come through the door. And so as a young person who's a physician, that's really very exciting because you really get to get into the lives of people who you really might not ever interact with at any point in their lives.
So you didn't actually see anything about working in an emergency room that you really didn't like? I mean, everything seems to be fulfilling and rewarding, or was there some things about working in an emergency room that you really didn't care for?
That's a very, very good question. I like the emergency room because most of the people who work there are kind of adrenaline junkies. I mean, you're kind of really always doing something.
Right.
So if you're like really being very busy and active, it's really a nice place to work. The drawback really is physically it's exhausting because you're working generally 12 hours. And from the very first hour that you go in, you're really kind of running around, quote unquote. And you're doing multiple things, right? Because you don't have just one patient. You might have 10 patients that you're coping with. Some of them are critically ill, and then some of them really are not too ill. So you have to be able to multitask and do many things all at once. But then you also have a team that you're working with. So you're working with the nurses, with technicians, and you really have to do a lot of things really well. Then you're calling the consultants, the surgeons, and that's what's exciting about it. But really, physically, it's kind of exhausting.
Now, when you say you're working 12 hours, this is like a 5-day work week or just a few days throughout the week?
No, so generally the persons who work in the emergency room work shifts. So we would do only 3 12-hour shifts in a week. And really 12 hours is what you're scheduled for. But technically you might be there for 14, 15 hours, but really only 36 hours in a week.
Now, also on your bio, you kind of mentioned that many times the physical problems or the physical conditions, you also have to deal with the mental issues that's being brought into the emergency room. Could you kind of explain a little bit about those issues?
Certainly. So a lot of persons come into the emergency room because they're in pain or they're really vulnerable. So either because, and then when they're physically ill, I think persons go through stress. So you go through stress from just the pain itself, or you're coping with something that you might not. You come to the emergency room and you might be diagnosed with a heart attack or cancer or something that's really bad. And that will, I think, bring on some stress for the person. So that's one thing. And then we also interact with persons who come into the emergency room from trauma.
Okay.
Right. So if you're a victim of a gunshot wound or stabbing, that's also very traumatic for the person, not only for them, but for their family members. So there's lots of stress. We also see people who come in because they are affected by a mental illness, either because they're schizophrenic or they're depressed, and or if they're coping with substance or drug abuse. So we kind of get the mixture of both. So they may come in because of a known mental health problem, but even when you're physically not well, that's very stressful for people. And if you're coping with a chronic medical condition, a lot of persons will even go through depression because of that as well. Not only them, but their family. It's very stressful for them.
So there's a lot of different things about your job, and I know you're also an author. I know you traveled outside the United States. We're going to take a break on the first part of this show. We're going to come back and we're going to kind of let people know about your next journeys that you have taken as a doctor and as an author. Okay. This is Jonathan Small. I'm hosting All About You this morning with my guest, Dr. Gary Rhule, and we're going to be right back very shortly. Thank you.
I'm very happy to be here tonight to congratulate and support AccessTV.org. AccessTV.org has reached hundreds and thousands of people. It's done a great job informing the community about important issues in our city, our state, and our nation. I congratulate Stan McCauley and Naisha for the job they've done. And now with their new format, which will reach many more people, and which will be available through many more formats, the future is very bright for AccessTV.org. Congratulations, and may you continue your mission of informing our community. Thank you very much.
At Hartford Public Schools, we care about one thing above all, the future of our kids. That's why we're dedicated to providing all students with the knowledge and skills needed in the new global culture. Hartford Public Schools is thriving. More student success stories, more world-class facilities, more university and corporate partnerships, more amazing talent coming and staying in Hartford. This is how education is supposed to work. Welcome to Hartford Public Schools, where the future is present.
This is Jonathan Small. I'm host of All About You, and this morning I have a medical doctor, Gary A. Rhule, and we've been discussing his life, and we're going to get back into the second part of this show. Gary, we kind of left off indicating that I know you did some traveling outside of the United States. Could you kind of let people know some of the places that you went to and some of the things that you was involved with?
Sure. I worked in Harare, Zimbabwe, Grenada, Portland, Jamaica, Kingston, Jamaica, Guyana, South America, and recently Haiti.
Okay.
So I did medical missions in these places.
Now these are all volunteer work when you say medical missions?
These are volunteer work with a team of healthcare providers who go and provide work for folks there.
Now what made you come to this decision that you wanted to do volunteer work outside the United States?
Right, I mean, I really think it's very interesting to see how different cultures live and their approach to healthcare. And I've always kind of wanted to do that anyway. So I think living in those places, you recognize how very fortunate I think we are here, primarily because a lot of the places I went to, folks didn't have access to healthcare. And I really just always had an interest in seeing what that was like. Okay. So just understanding how different people and different health systems use their healthcare.
Now you're also an author too. You do some book writing, and you have your book right here, Sailing on Broken Pieces. Okay. Was this your first book that you actually published?
Right. So this is my first book, Sailing on Broken Pieces, and what it offers is a perspective on living with mental illness. Primarily because I live with a sibling who has both schizophrenia and manic depressive illness. And so what I recognize is while working in the emergency room, there are many families who go through living with mental illness and don't really know how to access those services in the community. That's one idea. And then the other thought was that there is really a stigma and discrimination both for the families and the individuals living with mental illness. And I felt very fortunate because I felt like at least I had the resources. I knew how to reach out to the community to get the resources I needed. But a lot of the persons I came into contact with, I felt didn't have that information. So this was just one way to say, look, even if you have a mental illness, you really can recover. It really requires a team of persons to help you recover, both for the individual and the family. So that's really kind of what I was trying to do, to give folks a perspective from both, because as a physician and as a brother and as the caretaker of the person living with mental illness. And really, I think you can recover.
So do you have any things that bothers you now dealing with somebody in your own family that has certain mental illness issues? I mean, are you able to stay focused and stay, upbeat about life in general?
Absolutely. I think the good thing that I've been blessed with, I think, because I've worked in the emergency room, because I actually worked in other different countries, I recognize that to really get well, as you kind of said before, physicians really, healthcare providers cope with both the physical issues, the mental issues, and the spiritual issues. And even if you're not well physically, I think you can get better. For example, if you have diabetes, I think you can get better. If you have asthma, I think you can get better. And likewise, if you have a mental health condition, I believe you can get better. And even for my own sibling, that's definitely possible. You can get better. I think sometimes you can't really do it by yourself, but if you access the healthcare provider, if you have an advocate that helps you, if you kind of do that individual treatment plan, whether it's medications or in therapy, I think a lot of folks actually get better. And really, there are a lot of persons who've recovered, CEOs, doctors, physicians, any persons who are doing well, taking their medications in therapy, doing well, and I think recovery is possible.
Now, Gary, you mentioned some of the countries that you did medical volunteer work at, like Haiti. Now, what is it like when you went to Haiti? And I don't know if you was there when they had the earthquake, but at what point, did you actually go serve medical needs in Haiti, number one?
Right, so I went in 2013, which was after the earthquake, 2 years after the earthquake.
Okay.
And even though the conditions had improved, there were still some persons who were living outside, living in tents, and still waiting for health care. But very much like the developing country, they also have the same issues with access to health care. Really, there are not enough hospital systems, there are not enough healthcare providers, and the infrastructure really isn't there to provide the health care.
Okay.
But there are a lot of persons who are actually providing health care there as well. A lot of foreigners who came in. A lot of the local people are doing the very same thing. They're really helping the system there. But you kind of recognize that, and very similar to here, the infrastructure just really needs to be changed so that folks really have access to health care, both in terms of the hospital systems and the healthcare providers.
Now, Gary, when you go to these countries, how long do you usually stay at a particular time when you go do your volunteer work?
In Haiti, we were there for a week, but we've stayed longer for about 2 weeks. And in general, what we would do, we would identify areas with the highest need, and then we may travel from one site to the next site and stay there for a day, usually in a community, stay there for a day, provide the health care, and then move on to another site.
Now, at this stage of your life, you're no longer technically a physician, doctor. You're doing a different level of doctoring.
Well, I guess once a physician, you're always a physician,
okay.
but I don't actually practice emergency medicine. Now, what I actually am doing is I work as a healthcare management consultant, which means that I work for a Medicaid managed care company and mostly do medical reviews. So I do that. And then I also do work with compliance to be sure that both hospitals and insurance companies are really doing the right thing for the patient, to be sure that the systems are in place, that when they interact with a patient or a member, that they're really doing the right things for them. So that's what I primarily do part-time. And then I'm actually writing a second book.
Which do you enjoy doing them both at the same time? I mean, is one like a job or one is like a passion, as an author? I mean, how do you kind of view what you're doing?
Truthfully, as I look back on it, I think that really what I should have done is become a writer.
Okay.
However, I don't think that I could have gotten to this point without going through the experiences of working in the emergency room.
Yes.
living with someone with mental illness and really traveling to other places. So I think that at this point in my life, as I look back now, I recognize that this is a path I really had to come through to then share the information with people who I think really need to have the information. So I'm not unhappy that I became a physician. I just think that that's the route I had to go through to get to this point.
Was this book your first book that you published?
This is the first book I published.
Okay.
And I'm working on the second one.
Okay. So you plan to actually be doing more writing in the future? You're going to continue to be an author?
Absolutely. I mean, as healthcare providers, what we provide is information, right? So, but as a physician or as a nurse, you're really working with that person one-on-one. And so I'm doing really the same thing because I'm providing healthcare information, but to a larger audience. So I think once you read the book, what folks will really get is information about, if you're the individual or the family living with mental illness, really some tips and strategies how to cope with that. So, but I'm trying to do that on a different scale.
Okay.
You know, when you go to your doctor, it's really just you and the physician interacting.
Yes.
This book, my thought was to provide information to a larger audience. So really, I'm still a physician, I guess.
Yes.
But just in a different way.
A different way, okay. Now, I know in your bio you mentioned some of the inequities and the disparities in the medical field. And I don't know if you've, at this point, crossed this issue with a lot of your veterans having some waiting list problems and even dying. I mean, have you ever crossed any of those areas, or that's something totally separate for what you have been working with as a physician?
Right, so I don't specifically work with veterans necessarily, but there are certain populations who I think are at risk, who don't have access to both the healthcare system and don't have enough information about how to access it. And certainly veterans are one of them. For example, when you look at veterans, there is a high incidence of both depression, anxiety, or post-traumatic stress disorder. That's one piece. And or if they have chronic medical conditions, how they're inappropriately addressed. And then there are other groups who are really vulnerable too. For example, persons who don't speak the language.
Yes.
Persons who are not familiar with how to maneuver through the healthcare system. So be they African American, Hispanic, Mexicans, who don't really know how to access information. So I think that's why the healthcare disparities persist. And if you look at things such as mental health issues, diabetes, cancer, asthma, and if you look across different races and ethnicities, that we are disproportionately affected because of that. We don't have the information to how to access the information. And certainly veterans would be one group.
Exactly. And you were a doctor, a physician in an emergency room in an urban setting of the city of Hartford. So obviously you've seen a lot of social conditions of people not having medical insurance. You've probably seen gunshot victims at a higher number than probably a suburban town. Is there a difference as a doctor working in an emergency room in an urban hospital comparable, let's say, to an affluent suburban hospital?
Absolutely.
It's a difference. Okay, I just want to find out from you.
Right, absolutely. I mean, absolutely. So, we talk a lot about the social determinants of health, meaning that if your housing is unstable, if your job is unstable, if you have no health insurance, certainly you are probably more likely to be exposed to many, many different things. So if you're working in an urban center, there might be more gunshot wounds, there's more stabbings. But then for us, we're also a trauma center. So you're closer to major highways. If there are car crashes going on, most likely you're going to be the place where they come to. But besides that, of course, if you have persons who are affected by high unemployment and they have no insurance, they're going to be less likely to go to their physician because really that's the only place that they perceive they can get health care. So there's a high likelihood that they're going to come to the emergency room for care.
Okay.
And then if there's no continuity, if they feel that they have nowhere else to go to for care, for example, if they have diabetes or asthma and there's no primary care doctor they can follow up with, they're going to come back to the emergency room for care. So you do see a different spectrum of issues. And then again, also if there's a high incidence of people who are homeless, because of housing instability, they're going to come to your emergency room. If you're in the suburbs and it's a low incidence of homelessness, maybe they won't see that many issues. So definitely.
Well, let me ask you one issue of late. You've been hearing a lot of talk about heroin and a lot of heroin overdoses. Physically and mentally, have you ever seen a person come into your emergency room OD'd on heroin?
Yeah.
Okay.
We've seen people who've come in who've OD'd. Unfortunately, some of them have passed away, but that happens.
Could you kind of explain to people what happens to your body when you are overdosing on heroin? Or could you kind of explain to people exactly what takes place?
So heroin essentially is like an opiate, and what it does is it slows down your respiration. It affects your consciousness, so you become unconscious. But really, primarily what it does is it stops your breathing.
Okay.
So obviously, if you can't breathe, there's no oxygen in. Everything really kind of shuts down. And so what we would try then to do would be to reverse that by giving them a naloxone, giving them medication to reverse it. But unfortunately, what has happened is sometimes in certain areas of the country, we're seeing heroin being mixed with a higher dose of a medication called fentanyl that really stops your breathing, and it also stops your heart. So, and if we don't get to that person in time, obviously they pass away.
Is this something that you think can be fixed at the rate that we're going? Do you see any underlying issues that America is not really addressing about this heroin problem that you would kind of explain to people?
Right. So I think what we do as healthcare providers and as public health people is to give persons information.
Okay.
Right. So I think my experience has been people who are using a substance, if it's heroin or alcohol or cocaine, usually they're kind of trying to cope with something that's going on in their lives.
Yes.
And if you help people to cope before they get to that point by being in proper housing, proper education, giving them information, I think you help that way. That's one way. And then the other way, I think, is if you also give information about the side effects, the fact that they can actually die from a heroin overdose, from a cocaine issue. I think if you give them the information, they're less likely then to try it because some friend or someone tells them, try this, it's okay. So a lot of it really is about information.
Okay. And do you think as your role at the stage you're at right now in your life that you're trying to provide a lot of information still into the community at different levels?
Absolutely. I think as a physician, as a healthcare provider, that's really our role. And actually for you, that's also a role. I think if we give people information and then we help them how to access that information. If they wanted to find out more about information about substance abuse, where do they go? So I think that's part of our role.
Do you plan to take any more trips outside of the United States doing voluntary missions? Okay.
Actually, I plan on going to Martinique in July to do a medical mission with a group again for a couple of weeks. And then in September to go to Jamaica to do some more volunteer work. Okay.
Well, Gary, I know you do a lot of things with your life, and you've definitely been able to enlighten a lot of people. There's a few hobbies that you have. I know you like to listen to music and you like to read.
I do.
To do that.
I mean, that's primarily what I do. So I like reading, and then I love music, so I listen to a lot of musics. I love sports. I kind of watch sports on television. I'd love to go to a basketball and a baseball game, but I haven't gone. But I really kind of do that just to kind of unwind.
Unwind, okay. Well, pretty much we're just about out of time. Is there any last words that you would like people to know about your life or what you're planning to do in the very near future?
Right, so pretty much what I'm doing at this point is promoting the book and talking about Sailing on Broken Pieces, primarily because I believe that mental illness, that you can recover.
Okay.
That there are people and institutions out there, for example, the National Alliance on Mental Illness, that provides both peer support and family support for persons living with mental illness. And really that you have to get a team behind you, that you shouldn't try to do this by yourself, and that you can recover from mental illness and really live a very full life.
Well, Gary, this is a very enlightening, informative conversation that we had here this morning. I really appreciate you sharing your life and what you've been all about.
Thank you.
Okay,
Thanks for inviting me.
All right. This is Jonathan Small. I hosted All About You this morning, and basically I had enjoyed having my guest, medical doctor Gary Rhule. And as I tell people throughout the week, there's many other good shows on accesstv.org network that you can tune in. And as I also say every single week to people out there, have a very blessed day and keep the faith. Thank you.